Welcome back. If you are an allergy sufferer, the arrival of spring can be a mixed blessing. You love the warmer temperatures and the greenery and the longer days, but the itching nose, sneezing, and watery eyes can make life unpleasant. Fortunately, the doctor is in. Dr. Talal Insuli is with the Watergate and Burke Allergy Center. He joins us now. Welcome back. Good to see you.
Thank you for inviting me.
Always great having you here. I'm sure your phone rings off the hook when spring arrives. Is every spring pretty much the same, or does it vary from year to year? And if that's the case, what has 2016 been like?
2016, we have been seeing suddenly within the last 2 weeks a significant increase in pollen. So we have been having the juniper pollen, elm and maple pollen. These are the trees that are blooming and causing a lot of problems. And this is affecting tremendously patients with hay fever. They get stuffy nose, runny nose, sneezing, their nose is blocked. They get itchy eyes, watery eyes, red eyes as well. And also we have the patient with asthma. Important to know that asthma, I think, greater deal of individuals who have asthma do not know that asthma is mainly an allergic disease of the lungs, that allergies cause asthma. And these patients start to have allergy symptoms in the lungs that results in wheezing, cough, difficulty breathing, shortness of breath. So I think it's very important for the viewers to know not to wait too long for them to be treated. We like to have medication on board to block the allergy receptors about 2 to 3 weeks before the pollen season, before the allergy season. And we see it often when patients come to see us late. The treatment is much more difficult because already the allergy mediators are out, their symptoms are out. So early treatment, very important, not to wait too long, since we know that, for example, last year they had some problem with the trees. Have your treatment to start early.
Jumping on your allergies when you first feel the symptoms can help, it sounds like, shorten and reduce?
And more effective, absolutely.
More effective?
So even before noticing the symptoms, if we know that during the tree season we have some problem, maybe at the end of February, March, beginning of March, to start to take the medication about 2 to 3 weeks prior to the allergy season, studies showed that we block and we prevent these exaggeration of allergy symptoms, and then the treatment will be more effective and patient will enjoy their spring.
We have 2 segments with Dr. Insuli, and we want to give you an opportunity to ask a question or get some advice from him. He's with us several times a year, typically spring and fall being, it would seem to me, chief times when people like us are suffering from allergies. So phone lines open, number at the bottom of the screen, dial now. It increases the chances we'll get to your call and your question. 703-387-1020 is the number here. We're able to take calls in the 11 a.m. hour, so if you're watching between 11 and 12, dial in. We will go to the phones as your questions and comments come in. The things that we see advertised on TV tend not to distinguish between the cause, the source of the pollen. Are your treatments predicated on what the individual person seems most allergic to?
Yeah, absolutely. I think one of the most important steps in treating allergies is finding out what the patient is allergic to. So we do an allergy skin testing that within 10 minutes we'll be able to find out the nature of the allergens. Number 2, we'll find out the severity of the allergy that the patient has. And once we get the history along with that, we'll be able to tailor an appropriate treatment for the patient to get better. So it's important we have an individualized treatment for every patient depending on their symptoms, depending on their allergens, depending on the severity of their allergic reactions, and this will allow the patient to have good quality of life.
Give us a feel. You've brought show and tell, and we always welcome your show and tell.
Sure.
Give us a feel for what's in the arsenal and how you approach getting people the relief that they're craving.
Absolutely. I think this is a model that I always like to use it. So this is the nasal cavity. If you look at it clearly, and the nose is a tunnel where we do have a variety of things that do happen. We notice on this side that we do have the allergy nose with swelling of the lining. We have mucus secretion. This is the tip of the nose in here. And this is the normal nose. So when we have allergies, the inflammation and the blockage can block the sinuses. What's the sinus? It's a tiny pocket. We have 8 pairs of these pockets, the frontal sinuses, we have the sphenoidal sinuses, the maxillary ones, and the ethmoidal ones. And these sinuses are connected, all of them, with the nasal cavity. When the nasal cavity gets congested, and we have increase in mucus, they cause the sinuses to act up and we get sinus infection. So often patients tell me, Dr. Insuli, I don't have allergies, I get recurrent sinus infection. You are an immunologist, check my immune system. I tell them, hold on 1 second, before going on immunology, let me check your allergies. And often these patients are allergic. We treat their allergies, we prevent sinus infection, we prevent them from using antibiotics after antibiotics and after antibiotics that are known to be harmful if we use it all the time.
So it's not just the nuisance factor, if you will, the discomfort, the itching, and all the things that we hate about allergies. If it gets to the infection level, we've got double. It's sort of like double the problem.
Exactly. We call it the morbidity as well. And in addition to that, we know that we have some systemic problems that can occur. We show that allergies left untreated can lead to fatigue, tiredness, lack of energy. So we did a study that we published a couple of years ago. We showed 80% of the patients that have allergies have fatigue, lack of energy, and we treated their allergies. 70% of them get better.
And just as the days are getting longer and we're theoretically out and enjoying life more, you're feeling sluggish and all you want to do is sit in the chair.
Very important.
Calls coming in now. Let's begin with line 1. Hello, Laura in Woodbridge. You're on the air. Go ahead, please.
Yes, hello. It's a pleasure to talk to you, doctor.
Yes.
Thank you for calling in. Your question?
My question is, I've been suffering from allergies for a while, and now it turns into asthma. I have asthma for quite a few years now. And I've been taking nasal sprays. The last time I went to check to the doctor, which is 2 weeks ago, he told me that I have a lot of allergies in my nose. So he prescribed a nasal spray day and night. And also I take Singular and I take Zyrtec. Now my question to you is, should I keep taking this medication? There is the way that I can help myself so my chest doesn't start wheezing, because I do get a lot of fatigue and I do get a lot of discomfort in my body, and I don't feel much energy.
Yeah, we all sympathize.
Absolutely. So Laura, I think, is illustrating the study that we did, that allergies can lead to fatigue and lack of energy. So important to know, we're talking about fatigue, Laura, that's a good question. Laura, you have to be aware that Zyrtec is a good antihistamine but can cause some sedation. So I will not go on the Zyrtec. I will use a non-sedating one, such as Allegra, fexofenadine, or the Claritin, desloratadine, or Clarinex. These are non-sedating ones, and they are over-the-counter. You can have them, number 1. Number 2, talking about the nasal allergy and the lung allergy, asthma. So the Zyrtec, your nasal spray, is fantastic. Use it because the nose is a filter for the lungs. I always tell my patients we have to have a clear nose in order to breathe well. However, to treat asthma, we have to use the appropriate medication in the lungs. We have to have the appropriate inhalers. We have the anti-inflammatory inhaler medication that we use. We have the bronchodilators as well. So we have to add, I think, to Laura's treatment and a appropriate treatment that will get to the lungs and to clear the lungs and prevent her asthma attacks.
And good to have a conversation with your doctor about what to expect in terms of a drowsy impact of the medication, so that you can plan driving or other things.
Absolutely. So it's very important to mention to your doctor that you have also with your allergies some fatigue and some tiredness, and to get the non-sedating antihistamine that are very effective and very safe.
Dr. Insuli, stand by for just a moment. We're going to take a break here. Most of you will see much more of our conversation with and our phone calls for Dr. Talal Insuli. Of course, you can always watch News Talk videos online on our blog. It's news8newstalk.com. We're back in just a moment.